In this video, we are going to take a look at macrocytosis. Before I even put the slide on the microscope, I looked at the analyzer printout, and the red cell indice, the MCV, the mean cell volume on this particular patient was 110.7, which is definitely elevated. Normal tends to be around 80 to 100 femtoliters. So I would expect to see some macrocytosis or some macrocytes on this particular slide. So looking at the smear here, what we're looking at here is on the 100x oil lens, so 1000x total magnification. You certainly could do an assessment of the MCV or the amount of, macrocytosis or microcytosis on 40x, the high dry, but just to get a better look at them, I'm choosing to go up to oil. So here we have a nice segmented neutrophil right in the center, and using that as our point of reference, I would say about like 9 or 10 o'clock, meaning on the left, we have what I call like a normal red blood cell. Normally you could probably fit like 2 to 3 normal red blood cells inside a mature segmented neutrophil, and I would say that particular red cell that I just mentioned would fit that criterion. Now, if we go to 6 o'clock, we can see a red cell that is definitely bigger, and I would say that you probably could fit maybe 2 of those, maybe even 1.5 inside that neutrophil. And then if you look at like 3 o'clock, a little bit further over, you can see another macrocytic red blood cell. And then just going around, I'll move the field of view here and try to find another. Okay, so here's another neutrophil. What I really would like to find is a small lymphocyte. So let me just look around here a little bit and see if I can find one. I don't like these videos to be too long. Therefore, I'm not going to spend an inordinate amount of time looking for a lymphocyte, because this patient's white count, according to the analyzer, is certainly normal. So, we may have a hard time. Okay, so here we go. Okay, so here's a small lymphocyte. And normally a normal red blood cell should fit into a small lymphocyte. And you can see here that red blood cell, like at 5 o'clock, is the same size, if not even bigger than that lymphocyte. So yeah, so I'm seeing clear indications here of that there is macrocytosis on this slide. Now, one thing that you may see on the instrument printout, if you have macrocytosis or microcytosis, is an increase in the RDW on the analyzer printout, meaning the red cell distribution width. And that is used to measure what we call anisocytosis, or the variation in the size of the red cells. Now, oddly enough, with this particular printout, the RDW was 14.4, which is normal. RDW tends to be, depending on what your source is, maybe 11.5 to 15. So I would argue a little bit with the instrument readout. I think that there's enough variation in the size here that I would call at least 1 plus anisocytosis. And that brings up a very good point of why, despite all the advances in automation and instrumentation in the laboratory, which are hugely helpful and have changed medical laboratory science, the human eye is always going to be the go-to when the instrument, doesn't quite live up to every expectation, which it can't. But they do a lot. But the human is always going to be needed.